If you are a patient of epilepsy, or if you've been getting seizures or fits because of a head injury, because of a brain tumor, because of a stroke in the past, or because of some metabolic entity, and you've been put on some anti-epileptic medications, it becomes very important to listen to what I am telling you now. This is something which I would advise to all my patients when I meet them. First thing is how to decrease or reduce the possibility of a seizure happening. So for that, the most important thing would be the medications that you've been prescribed. Take it on time, take it regularly. Apart from that, avoid alcohol. Avoid bright lights, especially the flickering ones. So something where, so you can imagine a discotheque, that kind of light is something which you should be not exposing yourself to. Then get adequate sleep. So once these 3-4 things are in place, the possibility of a seizure goes down. Now the second thing that is equally relevant for me would be, just in case there is a seizure, what is the circumstances that you should find yourself in? Or in case of a seizure, which is the circumstance that you should avoid yourself being in? First one would be driving. Avoid driving a car, avoid driving a bike, a plane, a train. So avoid these things. Why? That's because if you have seizure, you lose control over yourself. You lose control over the vehicle that you're on, and then you end up crashing into somebody. So at the end of it, you've not just threatened your own life, you become a threat to others' lives as well. So both hospital as well as the jail would be open for you once you are out of this tragic accident. So avoid doing that. The second thing would be avoid swimming. So if you're swimming and you get a seizure, you might drown. Third thing would be, if you're traveling by train or bus, I would suggest, unless you have a place to sit or stand inside the bus or the train, do not take it. The idea of standing outside the door and hanging on, no, not for a patient of epilepsy or seizure. So these are things which you should avoid. In simple terms, do not be involved in an act where if you suddenly lose control over yourself, which is a possibility in a patient of seizure. You suddenly get an attack of seizure and you've lost control over yourself. So if you find yourself losing control over yourself, you should fall, or you should be in such a place where you are safe. So that is the idea behind all these recommendations. So once you've understood this, I think you will play it safe. So that's it. Very few but very important points which would obviously firstly prevent seizures, and secondly prevent further injury in case a seizure occurs. Thank you so much.